Good.
Jim Holland has diabetes. He and the others at this table are part of a new treatment approach in Masset, a small community located at the northern tip of the Queen Charlotte Islands, otherwise known as Haida Gwaii. It's a fishing community, but the town also provides health and other services for the 2,500 or so people who live in the region. It's always difficult to get doctors and other medical staff to work in isolated, largely rural communities, and Masset is no exception. Dr. Peter Rempel, who's now retired, served as a doctor for the military in Masset before the base closed down in 1997.
There's a joke in town here that says, "Who's your doctor?" and the answer is Dr. Locum. And that was always a problem, especially people who are older and had chronic diseases. The tests would be done, results would come back. By the time the results came back, the ordering doctor had disappeared. There was no follow-up.
That was the situation 7 years ago when Dr. Vinita Lokanathan came to work in Masset. She had trained in rural health, so many of the challenges were familiar. But the situation in Masset was especially taxing, as she was on call every third night and then expected to work in the clinic during the day.
So if you're somebody who's staying in the context of this constant turmoil and turnover, you end up being relied on a lot, not just for your skills as a physician, but in a lot of areas administratively and just organizationally and structure, because everyone's always asking you to sort of problem solve around all these things.
She felt she had to do something to improve the situation. She heard about a new approach called CDM, or Chronic Disease Management, and the CARE model. CDM promises improved outcomes for patients, greater efficiency and satisfaction for the health practitioner. It advocates keeping and monitoring relevant health data at both the individual and population levels. Patient health can be followed over time and patients recalled when appropriate. Population health trends can be identified. The model also advocates the need for a productive relationship between the practitioner and the patient. The patient needs to be informed and activated. So does the community. And there must also be a proactive and supportive practice team in place.
We were kind of at a critical crisis point in Masset where it was almost an obvious choice to do something differently because everything was such a disaster.
The first thing she did was recruit her own physician-led team, comprised of the diabetes nurse educator, the dietitian, and the public health nurse. Focusing first on diabetes, the team recorded baseline measures for tracking and monitoring individual and population data. Then they decided to establish a group clinic, inviting patients who were already seeing multiple members of the team. Shelley Crack is the community dietitian for Haida Gwaii and the primary facilitator for the group held in this old church.
I'm really watching what I'm eating, and right now I'm journaling everything and doing cascading blood sugar so that I know what's triggering highs.
The original group of 15 met monthly for a year and a half. Those here today came for our benefit and a chance to get some follow-up support from Shelley. Patients would get their blood sugar and blood pressure tested, share a healthy meal, learn about topics related to diabetes and self-management, and have an opportunity to meet one-on-one with a doctor and a nurse or a dietitian. But that format soon changed.
As we did more and more group clinics, we found that people wanted to spend less and less time in those one-to-one settings and more time in the group settings.
It was humbling in a way. It meant that, we didn't have to carry the burden of having to convey all this information that about how to manage conditions. We could just support people in acquiring that through probably primarily through their peers and through the ability to ask questions in a different way and have a understanding that was more relevant for them.
And the patients began to get healthier. In fact, healthier than others with similar chronic conditions, not only in Masset, but throughout the province. A1C and blood pressure levels improved. And a higher percentage of patients set self-management goals.
The biggest thing is having the group of people that you can relate to. I find that really, really helps. You're not the only one that has diabetes, that other people have it, and they're coping quite nicely.
Before it was you went and seen the doctor, he says, okay, take these pills, and that was the end of it. It was just like a one-shot thing about every 3 months where the getting together with everyone that had diabetes and everything else, and then the little lectures we had, and the insights from other people and what was going on in their lives made a big difference to me.
And they take their insights and newfound knowledge out into the community, becoming a resource for family and friends with concerns about diabetes. For example, after the manager of the local co-op store came to talk with the group, he put healthy food signs up throughout the store. The professional team benefits too.
We had a lot of satisfaction to deliver, so we didn't feel like we were alone doing this really tough job and without a lot of support.
Sheena Howard, currently on maternity leave, is the public health nurse on Dr. Lochanathon's team.
I have a better understanding about what each team member's role is. So I may not have to wait very long to phone up Dr. Lochanathon and say, and some of the other doctors, and say, look, I have a family here, and this person the dad needs some Zyban, for example, and they know me, they know my practice, they know my training, and so they don't hesitate to say, okay, Sheena. They write out the script, and there we go.
However, implementing the new chronic disease management approach in Masset, which involves a team focus, group visits, patient registries and recall, and patient self-management, has not been without challenge. Recently, Shelley took on a new role as the CDM program coordinator for Masset. It's her job to get more health staff on board, and she's meeting some resistance.
The biggest barrier is getting people to buy into it and realize that it's not extra work, it's just smarter work.
My view is down the road, probably everyone's going to have to entertain some form of this, so we might as well get on board now while there's money and incentives and support to do it.
I've just been diagnosed with adult onset diabetes, so I'm first-hand knowledge of how these teams work, and it's excellent. In fact, I feel a little bit badgered. So I'm not going to fall through the cracks. It's very good.